Santa Clara County Supervisor and Board President Can Yeager emphasized the need for an LGBT Health Survey. Aejaie Sellers recently interviewed Ken to find out how the survey is going and what the county hopes to do with the information. Stay with us for Aejaie's interview later in our program.
Hi, this is Aejaie Sellers, and I am at the County Board of Supervisor offices in Santa Clara County, and I have the distinct privilege of talking with Supervisor Can Yeager, who is our sitting board president. Thank you for taking some time to talk with us, Ken. So Ken, we know that the survey for the LGBT community has been conducted, but what was the impetus of conducting the LGBT survey?
Well, the county has a history of doing health assessments of certain segments of our community, but we had never done one on the LGBTQ community. But I wasn't really sure that we really had the facts to sort of back up what kind of programs that we needed. And so this health assessment will give us that kind of information that will be very useful in our planning. There really is very little information out there on all these issues dealing with the LGBTQ community. It isn't just sort of health, it's mental health, it's drug use, it's any number of things. And I know that we've gotten a lot of responses from other counties in California eager to get the results so that they can use this information as well. Not only do you provide better services and get a better sense of what's going on, but when you apply for grants, you really have the data to back up what it is that you are going to use the money for. So.
We know that many community partners were involved in coming up with the survey, but who are the main county agencies and community partners assisting you with this project?
We did have a community meeting of a lot of stakeholders that would people come, and then we, the company that we've hired to do this, Research Development Associates, had sort of come up with a draft, and then we had a large community meeting where people then could sort of fine-tune the questions. But certainly within the county itself, public health certainly was very important, but drug and alcohol, mental health, there's a lot of questions dealing with domestic violence, so that we had that part of the county in as well. So.
What information is the county trying to gain from the health survey?
About what are the major issues in our community, not only by gender, but by age and by race, HIV status, all those type of things that you think, that we want to make sure that we're addressing. So we wanted to include, again, all the type of questions as far as the type of services that the county provides. And I think we're really going to find out if this is working. Some of the questions are, how comfortable do you feel talking to your primary physician? And we can use that information to talk to health providers to say, can you be more encouraging to ask those type of questions? We have questions about social acceptance. Do gays and lesbians feeling comfortable in their community, at their workplace? If we find out that it's more of a problem than we realize, then we can have an education campaign towards that. STDs, HIV, all those type of questions. Are we providing enough services? Are they getting it from their private health insurer? So once you sort of know all of those type of things, then we can put policies in place that will begin to address them. It's going to be my responsibility as the openly gay county supervisor to make sure that all the agencies in the county, anyway, are addressing the concerns that we're finding.
Have all the members of the LGBT community been well represented in the survey's collection?
Well, we're tabulating the results right now. We closed the date for people to conduct the survey October 23rd, so we're still trying to figure that out. But certainly on a preliminary basis, it's looking very good. We've been really trying very hard to hit all the different age groups and the demographics, and we do that by using our stakeholders group, but also by those people and organizations that have emails or web or a tweet to let people know that the survey exists.
How many participants have taken the survey to date, and how many are you looking for total?
We wanted to capture 1,000 people overall, which was a very high bar. It's not easy to get 1,000 people to respond to your survey, and we were able to hit that mark, and so we feel good about that. Then we wanted 100 people for youth, and it looks like we were able to get close to that as well.
What changes have you seen in the county in regards to the LGBT community over the years?
We're finding more LGBT people in top leadership positions. We're finding more LGBT elected officials. I just think people feel a lot more comfortable about being out. And certainly here with so many young people, so many tech companies that have very progressive policies, I'm finding people are just much more willing to disclose that they're LGBT. When you think of certainly now that LGBT people get married, certainly people are aware of that as well.
Finally, Ken, once the survey is completed, will the results of the survey be available to the public?
Oh, absolutely. We want everybody to know what the results are. We look forward to sort of getting the interpretation. Certainly, I think LGBTQ people are going to be interested in knowing what the surveys are. So everything will be available. We'll have the analysis. So we'll have a community meeting where we're able to sort of talk about the results. And then, as I said, the next step really is trying to figure out the policies to address them, not only for the county, but also, again, for private insurances or anybody sort of dealing with the LGBT community, so that we can find out what the needs are, what the concerns are, and making sure that we're addressing them. All of this information will be certainly available to the public. I look forward to everybody having that information and, again, understanding our community even better.
I'd like to take this time to thank Supervisor and Board President Can Yeager for putting this survey together, taking some time to speak with us, and really being concerned about the LGBT health issues which afflict our community. Thank you, Ken.
Well, thanks, Aejaie. It's good to see you again, and it's always wonderful to be on your show.